Hi, in this presentation, we will be discussing anxiety, different anxiety disorders, and how anxiety disorders can be treated. Disclaimer: all content and information in this video is for informational and educational purposes only, does not represent the views of OU-HCOM, and does not establish any kind of educational mentor-client relationship. Content warning. The content of this presentation may be emotionally challenging as it discusses sensitive topics surrounding mental health. If at any point a break is needed, please take one, and be sure to use the resources provided as needed. First, what is anxiety? Anxiety is a feeling of nervousness, worry, and/or fear. These strong feelings can make a person feel sick. For example, a person feeling anxious can have an upset stomach, need to go to the bathroom more frequently, feel dizzy, not be able to sit still. It can feel like their heart is racing. So, what are anxiety disorders, and what makes them different from anxiety? We all feel stressed and anxious sometimes. This is normal. But anxiety disorders are different from these normal feelings of stress and anxiety. Anxiety disorders occur when a person is stressed so much and so often that it can make it hard for a person to live their day-to-day life. How this anxiety affects a person and their life can be different among different people. This leads there to be different types of anxiety disorders. Check-in. Answer the fill in the blank. Anxiety disorders are when people are stressed so much and so often that it can make it hard for a person to blank. The answer is that anxiety disorders occur when a person is stressed so much and so often that it can make it hard for a person to live their day-to-day life. This is important because feelings of anxiety are normal. It's when a person is feeling it all the time and it affects their day-to-day life that it becomes an issue. Next, we will be discussing some of the different types of anxiety disorders and their symptoms. Please note, this is not a list of all anxiety disorders. Since each person with an anxiety disorder experiences anxiety, there are a lot of common symptoms among those with anxiety disorders. A person with an anxiety disorder can experience some of these symptoms, including shaking, sweating, having chest pain, feeling like their heart is racing, feeling like they are having a hard time breathing, difficulty with relaxing and calming down, constant upset stomach, difficulty concentrating, getting easily angry or worried, and consistently experiencing negative emotions, having repeated unwanted thoughts about stressful things, avoiding situations and things that are stressful, even if they are necessary situations for a person to live their life, and difficulty sleeping. As seen here, there are many types of anxiety disorders. Let's break them down one at a time. One type of anxiety disorder is panic disorder. This is when a person experiences recurrent and intense panic attacks that happen unexpectedly. Panic attacks are when a person has very strong feelings of fear or panic for a couple minutes to an hour. People often experience symptoms linked with strong feelings of anxiety and fear, such as sweating, shaking, feeling short of breath, chest pain, dizziness, and having an out-of-body experience. Another type of anxiety disorder is generalized anxiety disorder, also known as GAD. This is when a person experiences excessive worry about various aspects of daily life, instead of just a single type of situation or thing. Social anxiety disorder is another anxiety disorder in which a person has extreme feelings of fear and anxiety while in social settings. A person can have intense fear of being embarrassed or judged. This may arise when needing to give a big speech or presentation, or even when invited to a party or restaurant. Another anxiety disorder is obsessive compulsive disorder, nicknamed OCD. This is when a person experiences repeated unwanted thoughts, known as obsessions, and compulsive behaviors. These obsessions or repeated thoughts can cause a person to feel very upset and worried. It is very hard for people to ignore these thoughts. The person will often then do something to help them get rid of those thoughts. This is called a compulsion. For example, a person might have the thought that there are a lot of germs on their hands and that those germs will make them very sick. This makes them very worried. So they wash their hands every couple of minutes, and this makes their thoughts and worry go away for a little bit. Another example is worrying about the door being unlocked. So they go to relock the door 10 times. Lastly, post-traumatic stress disorder, also known as PTSD, is when a person experiences extreme anxiety and distress after being exposed to a traumatic event. Many people think of soldiers who have experienced combat when thinking of PTSD, but traumatic events can also include being assaulted or hurt by another person, a car crash, natural disaster, medical diagnosis, or other events that are scary and a person is worried about their safety in life. People with PTSD can have unwanted thoughts, nightmares, or flashbacks about the traumatic event, avoid people, places, or things that remind them of the event, or be hypervigilant, which means they are constantly on guard and looking out for danger. These are not all the anxiety disorders, but some of the more common or serious disorders. Check-in. Answer the question. Which anxiety disorder is when a person experiences extreme fear and anxiety in social situations? A. Panic disorder. B. Generalized anxiety disorder. C. Social anxiety disorder. D. Obsessive compulsive disorder. Or E. Post-traumatic stress disorder. The answer is C. Social anxiety disorder, which is when a person experiences extreme fear and anxiety in social situations. Panic disorder is when a person has recurrent and intense panic attacks that happen unexpectedly. Generalized anxiety disorder is when a person experiences excessive worry about numerous types of situations. Obsessive compulsive disorder is when a person has repeated unwanted thoughts and compulsive behaviors. Post-traumatic stress disorder is when a person experiences extreme anxiety and distress after being exposed to traumatic events. Next, we will talk about treatment and lifestyle change options to help with anxiety disorders. Anxiety disorders, like many other mental health disorders, are complex. This means that a person may need to use multiple treatment options and make lifestyle changes to see improvement in their symptoms. It also means that a person may need to try different options before finding the right option for them. There are two main types of clinical treatment, which are treatments provided by a healthcare or mental health professional. First, medications can be used to help with the symptoms of anxiety disorders. These medications need a prescription from your primary care provider or a psychiatrist. Please note that when a person starts a medication, it can take a couple months for a person to feel improvement. This is because it takes a while for the drug to get to the needed level inside the body. Another option is therapy, in which a person talks to a mental health professional. There are many different types of therapy, and each addresses the struggles a person has in a different way. Talk to your provider about what may be the best option for you. Please note, it can also take therapy a couple of months to show noticeable improvements. If you feel like a treatment option, medication, and/or therapy is not working for you, talk with your provider. There are multiple options for both therapy and medications, and sometimes it's a trial and error to find what works best for you. Also note, before going to your provider, write down when anxiety symptoms occur and what makes them better or worse. Also write down how they affect your day-to-day life. This can help your provider diagnose and provide better treatment recommendations. Though, as said before, keep in mind that some treatment options may take longer to see effects. There are also non-clinical treatment options to help with anxiety symptoms. These are treatment options and lifestyle changes that can be used in combination with clinical treatment or be used on their own. Some lifestyle changes that can help improve anxiety symptoms include cutting back on drinking caffeine. Going cold turkey may be difficult, so start by cutting back 1 cup at a time. Consuming drugs, alcohol, or smoking can also make anxiety worse. Use of these can also lead to other medical issues causing even more stress and anxiety. There are many ways a doctor can help you cut back on these areas. Going cold turkey on some of these substances, like alcohol or drugs, can be very dangerous, so please seek out medical guidance when you are ready or interested in quitting. Don't forget that sleep is a priority. It gives the brain a break and a chance to reset and recover from the day. Lastly, don't keep anxiety to yourself. Ask for help. Additional lifestyle changes and sources of support include reaching out to loved ones and friends, contacting a spiritual leader, or someone in your faith community. You can also look to join an anxiety support group to talk with others facing similar issues, either virtually or in person. Being active is also very important. Exercise can significantly help reduce stress. It can also be helpful to find activities that help distract you or help calm you down, such as taking a walk, dancing or singing a song, taking a drive, meditating, etc. Everyone is different, so find what works best for you. Additionally, keeping a journal can help a person keep track of their life and what makes their anxiety better or worse. It can also help guide your doctor or therapist towards better treatment options. Check in. What are some lifestyle changes that a person can make to improve their feelings of anxiety? Here are some options to lifestyle changes a person can make to improve their feelings of anxiety. It's important to note that what works for one person might not work for another. Just try to find ways that help you reduce your level of stress and anxiety and make you feel happier and healthier. In summary, anxiety disorders are when a person feels such extreme anxiety that it affects their day to day life. Common treatments include medication, therapy, and life changes. Note, it can take a couple of months for treatment to take full effect. Contact your provider if you feel like your stress, fear, or worry is overwhelming and affects how you can live your life. There are many hotlines and online resources that can be used to help connect people to mental health resources and a counselor for both non emergency and emergency situations. If you or anyone that you know is having thoughts of hurting themselves or others, there are hotlines that can be called or texted for help, including the ones on this page. Here are the sources of information about the anxiety disorders, and treatment options.